Most people are destroyed for lack of knowledge. That is from Hosea 4 and 6. And I love that quote or verse rather in the Bible because it reminds me that most of the time when people run into trouble with their health, it's not because they're not intelligent. It's not because they're lazy. And it's not because they don't care. It's because the knowledge of their bodies, medical instructions, medications, all of that just hasn't been clearly explained and it hasn't been nurtured. And I specifically use that word nurtured because people need to hear things 2 to 7 times, depending on the complexity, to even remember it. And I remember telling one of my faculty members this when I was a pharmacy student that I just need to keep hearing it. I need that repetition. And so it's a true statement. It's backed by data. You need to hear things 2 to 7 times before you remember it. So if you haven't heard it lately, or if you haven't heard it at all, today in this video, I want to talk about metformin, which is one of the most widely used medications for diabetes. And I do think metformin is really, truly a great drug, but I don't think that many people fully hear the story about this medication. And it is our job as healthcare professionals in this field to make sure that people hear the full story. But also, I want to turn that back around on you. And I'm glad you're watching this video because I think it's on us as patients, consumers, to understand what we are doing and to recognize that it's our job, it's your job as the CEO of your body to access that knowledge, which means asking questions, watching videos, that kind of thing, and to act on it. So, again, most people are destroyed for lack of knowledge. So, if you're new, my name is Takova. I am the community's pharmacist. And on this channel, we break down medications in plain language so that you can feel confident, empowered, safe, in control of your care, whatever the thing that is making you feel stuck when it comes to your medications. I want to help add some clarification to that or add some clarity to that. And I will say that the unfortunate truth of the matter is that so many people are embarrassed or nervous to ask a simple question about their medications because you may feel like the physician or the pharmacist doesn't have time to talk to you, or you don't want to feel dumb, or you don't know the right questions to ask. There's just so many reasons why people don't ask questions. I feel like I've heard them all. But let me be very clear. It is your right to know. We do have time. Most clinicians want to take the time to explain things to you. Even the ones that struggle with finding the right type of explanation. But we want you to ask. We want you to feel empowered to ask and advocate for yourself or your family member if you're helping take care of somebody. And again, it's definitely our job to explain that. But I want you to know and show up like the CEO, the business owner of your body and of your healthcare routine. And I'm here to help you feel empowered to act like it. So before I talk about metformin, I do want to tell a quick personal story about my grandmother who, Lord rest her soul, has gone on to be with the Lord. But before I get into that, I want to say that metformin has a lot of trickiness to it. I mean, it's a really good medication, but I feel like people give up on it easily. So my grandma specifically took metformin for years. And I wasn't a pharmacist at the time, but I can remember that she was started on a specific dose of metformin and she was given a 90-day supply of it. Well, a month into that 90-day supply, she went back to the doctor's office and she was having some stomach issues and they changed her dose. I don't know for sure, but I think they put her on the extended release version. So now she's got 60 days worth of med left and she's being told to switch to something else. She put up a fit. She had just paid for this medication. She didn't want to switch it. You know, they're telling her she needs this new prescription, but not fully explaining to her what her other options are. And let me just say, it was the principle of the matter because she only paid maybe $5 or $6 for this prescription. So for most people, that's not very expensive. So it really was just the principle. But she's sitting here again with 2 months worth of perfectly good medication and being told that she needs to get this other bottle. And I was kind of frustrated for her because she was very frustrated and she refused to go get the medication. And that's why this story really sticks with me because of just the level of frustration that she felt with this. So I say that to say nobody sat down and said plainly, here's what this means for you. Here are what your options are. You can do this for the next 2 months and then do that. And I'm really learning that in this moment and looking back on it, it's not really about the pill. It's not really about the fact that she was having a side effect. It's about the person on the other side of the pill, the person taking the medication and how well they've received the information. I heard this quote recently that communication is not about what you said, it's about what the other person heard. And so when the physician said, we're going to call in this new prescription for you to replace your old one. What my grandmother heard was, you want me to pay for something, and I just paid for something, and I'm on a fixed income. So anyway, all that to say, I think if she had known a little more, and also if a little more had been explained to her, then she would have felt a little more empowered to act differently in that situation. And maybe her provider would have been able to provide a little bit more clarity if he or she had understood what her fears or concerns were about that. And also, before I move on, I just want to say another takeaway point from that is that she didn't really fuss at the physician for calling in a new prescription. She was very adherent or compliant during the encounter at the doctor's office. It was when she got home and she picked up the prescription and realized she had to pay for it and all this kind of thing. Like, she's expressing her frustration to the people around her. So again, it just goes back to this notion of making sure that you talk to your provider and let them know what your concerns are. All right, so let's get into it. Here are some background information things that I think that you should know about metformin. We know that it lowers your blood sugar. So has traditionally been the first line medication for diabetes. These days, it is a first line medication for diabetes. So there are other medications that we use first for diabetes beyond just metformin. And so you may be someone, if you are newly diagnosed with diabetes, metformin may not even be the first drug that we start with for you because we've got other options now. But in short, it helps lower the blood sugar by improving how your body uses insulin. So just humor me for a moment if you already know this, but in case you're watching this and you don't remember, insulin is something that we need to talk about. And I can go through it in more detail in another video, but just so that you get the context around metformin, I'm going to talk about it a little bit right here. So insulin is like an Uber for blood sugar. It sees sugar in the bloodstream, picks it up, delivers it to the cells all around your body, and even opens up the cell door so the sugar can go inside. Now, we need the sugar in our cells so that we can use it for energy. So when we consume things, mostly carbohydrates, that breaks down into simple sugars or glucose in our bloodstream, and then insulin takes that from the bloodstream, puts it in our body for energy. Our brain needs glucose for energy. Our muscles, all different cells of our body need glucose for energy, or it's the primary source of energy. So because people with diabetes have so much sugar in their bloodstream, the cells become resistant or opposed to insulin giving them more sugar. So when insulin picks up this sugar and tries to take it to the cells are stopping it. And so therefore that sugar just stays in the bloodstream. And when it stays in the bloodstream, it wreaks havoc on all parts of your body, your nervous system, so the nerves of the eyes and the feet and the gut, as well as wreaks havoc on your heart and your kidneys. And so it's an issue. We know that. So now that we know how insulin works, and in patients with type 2 diabetes specifically, because that is who metformin is used for in this context, it helps them use insulin better. And so it's going to help your body overcome that resistance from the cells. So it allows insulin to put sugar into the cells. And those cells become relaxed and more sensitive and more open to accepting more sugar in. Some other actions of metformin. So it helps put sugar into the cells, but it also decreases sugar or otherwise known as glucose production in the liver. So at baseline, our liver turns something called glucagon into glucose. And normally we could use a little bit of extra glucose coming from the liver. But if you're someone with diabetes, you already have blood sugar levels that are high. We don't necessarily need the liver coming in and producing more glucose for us. And so metformin reduces the amount of glucose that the liver produces. And also, to a lesser extent, metformin also slows the absorption of sugar in your gut. And so that's three mechanisms or three actions of how metformin works. It increases insulin's use in your body, especially in the muscles, it reduces glucose production by the liver and it slows the absorption of sugar in your gut. So, some common side effects associated with metformin, the biggest one is just GI upset or stomach issues. And this is the reason why a lot of people want to stop it. They start it and they end up with diarrhea, nausea, stomach cramping. But this usually, for most people, improves over time. And by over time, I mean like 5 days to a week. If it hasn't improved within that time, try to take it with food, or even after the first 2 or 3 days, if you're having some diarrhea, try to take it with food. Or like I think they did with my grandmother, you could go back after that prescription is done and, switch to the extended release version. But I do strongly recommend that you try to stick it out with it because, as I'll talk about in a moment, there are some other benefits to metformin beyond just lowering your blood sugar. So, again, a pro tip is to always ask for the extended release version or option if you have stomach issues that don't get better by taking metformin with food, and just don't quit on it too soon. Um, I think, understanding some of these side effects and what questions to ask and what labs to look for are things that are really important when it comes to managing your medication. And there can be a lot of different components to what that looks like. And if you're on more than one medication, which most people are, then it can start to get confusing about which medication causes what or what should you expect from one medication. And so one thing that can help with that is something called a medication mind map. This can help you kind of visually track things in one place. And if it's something, and it is something that, as I teach pharmacy and medical students, many of us as faculty members have them do. We have them create what's called a concept map, and it's otherwise known as a mind map. And so they take a core concept, put that in the center of the map, and then draw out arrows from the sides for different aspects of that particular concept. So in this case, I would have you put metformin at the center of your mind map, and then, you would put different things about metformin outside of that. I do have a quick video training as well as a template on how to create a mind map and how this can be helpful for not only you, but your practitioner, but mostly for you so that you can figure out what your stuck points are, what are the things that you know about your medication, and where are the areas that you're still kind of confused, and also to help you be a little bit more specific with what these medications are doing. And so if you have metformin and I ask you, what is it used for? Instead of saying, I use that for my diabetes, I want you to be able to say, I use that to help um, my body use insulin better. So just visually putting that in something or in a format that allows you to see it better. Again, I have a template, and with my template, I also provided a little quick video training that goes into a lot more detail. And I'll put that link in the description box below. So I do want to talk about some benefits that go beyond just lowering your blood sugar that metformin has. So it has been studied for weight management. Most of us still report to patients that metformin is weight neutral. And although when some people start metformin, they lose a little bit of weight, that's usually because their body is starting to use the insulin more efficiently and the blood sugar is lowering. But the medication itself may not be the thing that's causing the weight loss, just the better control of the condition. But it is still being studied for weight management. Also, it's used for PCOS or polycystic ovary syndrome. We still have a lot of gaps in like understanding what causes PCOS, but we are pretty confident that there is a big component of insulin resistance associated with it. So the same thing that's happening in diabetes is happening in PCOS. And so if we can kind of manage that a little bit, it helps. So we do use metformin in individuals who have or suspect to have PCOS. And it's even being studied in some anti-aging research. And so just helping with body systems and slowing some aging effects. One of the biggest things that I love about metformin is that it reduces the risk of cardiovascular events. And I think this is just near and dear to my heart because cardiovascular disease just runs rampant through my family, but it helps reduce your risk of having a heart attack, a stroke, and also reduces your risk of heart failure. And I think that's important because individuals who have type 2 diabetes are at a higher risk of having heart attacks and strokes and things like that. And so if you have a medication, and there are some other ones that do this as well, I'll talk about in a different video. But if you have a medication that helps reduce your risk of heart related events, then you're just, gotten somewhat of a golden ticket when it comes to controlling your diabetes and the rest of your health. Um, and the final thing that I'll mention as kind of a bonus benefit or bonus tip to watch out for metformin is that the kidneys need to be functioning well. This medication is removed from your body. Our body uses it, does what it needs to do with it. The extra medication is removed from your body through your kidneys. So if the kidneys aren't working well, the medication could build up in your system and it could lead to something called lactic acidosis. And that just leads to a lot of different side effects. And also it can be a medical emergency. So you want to make sure that not only are you getting your kidney function checked, but that you know what that looks like for you. So what are the labs that matter for kidney function? And again, this is something that you could write in your mind map so that you don't have to remember it. Nobody's asking you to remember all these details, but you figure it out once, you ask the question once, you write it out, and then every now and then you review it. Now, I also want to talk about goals with diabetes in general, but if you're on metformin, you got to know what your goals are. So, in terms of goals, we look at two main things. One, your daily blood sugar levels, and two, your A1C. So, I'll start with A1C because I feel like it's the easiest one because we check it at the hospital or at your clinic. So, your A1C, also known as a hemoglobin A1C, looks at the amount of sugar that's attached to your red blood cells, and it measures that in a percentage. And because your red blood cells kind of regenerate themselves after about 120 days, we only look at this lab about every 2 to 3 months. And so when we look at this lab value, we're looking to see how much sugar is staying in your bloodstream on average. So the number that most people need to reach is less than 7%. Now, that might be different depending on your goals and where you are. So obviously talk to your healthcare provider. It might be we might want it to be less than 6.5. And some people that may have more medical conditions, we might aim for it to be less than 8 and just be a little more liberal with that goal. But for most people, your A1C needs to be less than 7. We use that number to do a little bit of a calculation, and that gives us an average of what your blood sugar has been running over the past 3 months. So that gives us a lot of insight into whether or not the medication is working. Now, that's something that we can do at the clinic. What you can do at home is check your blood sugar level. And so it's important to check this often enough that it gives us data to know how your blood sugars are running at home more frequently. This is really, really important if you're on insulin. But in the context of metformin, you could get away with checking your blood sugar in the morning before you've had anything to eat or drink. 2 or 3 days a week would be good. If you could trickle in a couple of times where you check it an hour or two after you eat, that would be good as well. And so the numbers that you're looking for there, when you wake up in the morning before you've had anything to eat, that blood sugar level on your finger prick should be between 80 to 130. And again, this is for most people. Your physician may have a slightly different goal for you if you've got some other things going on to consider. But for most people, wake up in the morning, no food yet, it should be between 80 and 130. After you've had food, we wait about an hour, optimally 2 hours after you eat. You can check it again. That number should be less than 180. So you can just do some checks throughout the week after certain types of meals that you eat to see, what it is, what your blood sugar is running after you eat. And again, wait close to 2 hours would be ideal. Now, one of the final things, see, there's a lot with metformin. So that's why you need a mind map. Link below. Seriously, y'all. But one of the things that I feel like we don't talk about enough is the fact that metformin can lower or affect your B12 levels over time. And so having low B12 levels means that you might have fatigue, you might have memory loss or brain fog, but it also can cause some nerve tingling in the fingers, hands, and feet. And that kind of sneaks up on you. I think it's important to ask to get a B12 level checked every year or two if you're on metformin long term, because again, this can be confused with neuropathy, which is also a long term effect of diabetes. That may happen where people tend to get tingling in the fingers and hands and feet, and also loss of like sensation to touch in the feet. But initially, when you report your symptoms to your doctor, it sounds like neuropathy. And so I think it's important to get your B12 levels checked. You could be proactive, and in most cases, it would be okay to go ahead and take a B12 supplement. It doesn't interact negatively with really any drugs. And so you could go ahead and take that. But if you're not one that just wants to add medications in, I get that. This lowering of B12 doesn't happen in everybody. It is just a risk of something that can happen usually after about 5 years or so of use of this medication. So those are all the kind of practical points for metformin. And the bigger point here, though, is that having metformin in your hand and taking it daily really isn't enough. You need to have the knowledge, you need to use it wisely. Otherwise, it's like having a tool in your toolbox and never using it or never knowing how to use it. And also not knowing how dangerous it can be if you don't use it correctly. So don't be afraid to ask, what should I be looking for with this medication? What is this medication for? How does it work? What lab should I have checked? How does this fit into the bigger picture of my overall medications? And does it interact with any of my other medications? So those are the types of questions that empower you, that make you a smart patient, that make you the CEO of your care and of your body. And there are situations where I feel like questions that people ask, I'm like, why'd you ask that question? But I never do we feel that way in healthcare. There are no dumb questions when it comes to your health. There are no questions that are too small, no questions that are too big. And so I really just want you to think about it in that way. And, it's kind of like, if you are the CEO of a company, which I feel like my body, your body is your company. But if you're the CEO of a company, you wouldn't let somebody spend $15,000 on something without looking into the details, without checking off on it. Yet we let providers and pharmacists and whoever in our healthcare team do that every day. And they're not doing it intentionally. They're doing it to help you, but you also, have to feel empowered to ask questions, because ignoring the cost of uncontrolled diabetes, incorrectly taking medications, leading to hospital stays, vision problems, nerve damage, those are bills that aren't going to show up now. So people don't think about them, but they could show up later and wreak havoc and cause issues in your life later. So one thing that you can do is be very cognizant of your preventative measures and things that you can do to ask questions now about your health and about your medication. So again, metformin is just one of those tools that we use to keep you from having to see a hospital bill later, but just continue to understand and know how it works and what questions to ask. So again, I think concept mapping is great. I think you could at least try it. If you don't like it, that's fine. We may be able to find a different approach for you. Just let me know in the comments. But click that link. There's a short video that's going to go along with that, showing you how to actually fill out your med mind map. What are the exact things that should go into each section? Use that as a template, and then as you go along, you may decide you want to modify it slightly. It is going to enhance your learning, your understanding, your memory, your ability to critically think about what are the types of questions that I should ask. Because sometimes people ask questions, but they're not asking the right questions to get the answers that they need. And it's also going to help you with solving problems and improving your communication around your medications. So as you can tell, I love a good concept map. I love to see my students use it. I love to see my patients use it. I just think it's a really awesome resource. And it's a one page per drug type of thing that you can use. Or if you want to draw it out on a separate piece of paper, you could probably put more than one medication mind map on one piece of paper. But the template that I have, one drug per sheet, fill it out for each of your medications, ask questions where you need to fill it in, and go from there. All right, so I'm going to wrap this up. Remember the verse that I said at the beginning, my people are destroyed for lack of knowledge. So now you know how metformin works. You know some caveats associated with it, some benefits associated with it other than just lowering your blood sugar. And hopefully you feel a little more empowered around asking questions about metformin. And this is going to lead you down a rabbit hole of asking questions about all of your other medications as well. Metformin is powerful. It's a really good drug. It's an oldie but goodie, I like to say. It's been around for a while. But don't let your care be suboptimal because no one told you the full story or because you didn't ask the right questions. Cultivate the knowledge that you have around metformin, around your diabetes, and harvest that so that you can actually have a fruitful experience with taking this medication and with your health. So if you've learned anything in this video, if it has benefited you at all, hit that subscribe button, hit the like button, comment in the comment box if you want more questions, but at least like the video so I know that it's something that has been beneficial for you. And don't forget to grab that free template or that community service template below, because I really made it for our community so that you can use it as a first step, because there are other things that you need to do. But making a medication mind map is just a first step towards understanding your medication. So thank you. I'll see you in the next.